A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
Thank you for tuning in. I'm Justin T. Weller, your guest host of Mercy Moments from the State of Us podcast and True Chat Inc., the producing entity for this program. Today, we're going to be looking at lung cancer awareness. What do you need to know? There's a lot of misinformation out there, I think, about lung cancer, what causes it, who gets it, and what can be done about it. So we're going to walk through all of that today. And I am joined by Dr. Soumya Neravetla, who is a cardiothoracic surgeon practicing in Ohio. After graduating as valedictorian from Springfield North High School, she attended Northeast Ohio Medical University. She launched and served as director of the Structural Health Program and Robotic Thoracic Surgery in Savannah, Georgia, prior to her return to Ohio. At Springfield Regional Medical Center, she has spearheaded the lung cancer screening program and the expansion of minimally invasive cardiovascular surgery, including the launch of TAVR. In spite of her busy work schedule, she collaborates with her father outside the OR and in his mission to spread awareness about prevention of cardiovascular disease and lung cancer awareness. Dr. Neravetla, thank you for joining us. And it's important to note, too, that Springfield Regional Medical Center is part of the Mercy Health Network. So there's that connection to Mercy Moments. We're also joined today by my cohort from the State of Us, Lance Jackson, who is our senior resident historian at True Chat, and one of the honorary co-founders of the organization. Thanks for being here, Lance.
It's great to be here. Thank you.
So we've got two very qualified guests today. Let's start right out with how big of a problem is lung cancer?
Lung cancer is the number one cancer killer pretty much any way you slice it, whether you look at the world, whether you look at our nation, whether you look at just men, or whether you look at women. And in fact, locally here, lung cancer is the number one killer, period, in Champaign County and the number two killer in Clark County.
Wow. It
causes more deaths than breast, colon, and prostate cancer combined. That's huge.
I did not know that. That was interesting. You said that earlier, and I'm like, that's just amazing. I wouldn't have thought that at all.
Breast cancer, prostate cancer, colon.
Combined. And if you think about it, we tend to talk about breast cancer, prostate cancer, and colon cancer pretty frequently. We talk to our loved ones about getting checked for them. It comes up in conversation pretty regularly, but you don't hear those same conversations about lung cancer.
So who should be worried about lung cancer? I mean, that seems like the next question, right?
Yeah.
Obviously it's a big problem. It's the leading killer in Champaign County, and I'm sure there's lots of other places around the country where it is, and the number one cancer killer. So if you have cancer, more people are likely to die from lung cancer than any other type of cancer. So who has to be concerned about this?
The number one group of people that need to be concerned are smokers. So smoking is definitely by far the biggest risk factor. That's not to say that non-smokers don't get lung cancer, and there is some increased incidence in lung cancer amongst non-smokers, but by far and above all the other risk factors such as radon and secondhand smoke and some of the other environmental risk factors is tobacco use. And in fact, even with those environmental risk factors such as asbestos and other things that you might hear about, tobacco is actually synergistic. And so it's the use of tobacco associated with another risk factor that tends to exponentially increase your risk for lung cancer.
And you said off air that basically smoking is one through 9, right? Of the top 10 causes,
yeah.
you would say, just jokingly, it's basically 1 through 9.
Yeah, I jokingly tell people that it is the 1 through 9 because it's that big of a risk factor.
So, but it's important to note, right, that this is one of the major risk factors, but there's a lot of people who get lung cancer who never smoke, right?
Correct.
Okay. So other ways people can get common things that cause cancer beyond that include?
We're still learning a little bit more about what causes lung cancer in the non-smoker population, but there are some known risk factors such as radon, secondhand smoke, I think are probably the two most common. Environmental exposure such as asbestos, specifically with mesothelioma, which is kind of in the realm of lung cancer as well, is obviously another risk factor.
So talk a little bit about what your role is in fighting lung cancer and what makes you passionate about this topic.
Well, I'm a cardiothoracic surgeon, which is a very fancy way to say that I take care of things that are associated with the heart and the chest. So what that means for lung cancer is patients who have lung cancer who need the cancer cut out or resected come to me. So my role with lung cancer professionally is typically for resection when we're hopefully trying to do a curative resection. But I also have a role with some of the screening and staging because I do some procedures. One in particular is called endobronchial ultrasound, and the other is navigational bronchoscopy. These are fancy ways of saying that I take a camera down someone's throat and either take biopsies of lymph nodes or the mass themselves to help with diagnosis and staging as well. So professionally, I'm involved in finding out whether a patient has lung cancer, finding out what the stage of the lung cancer is, which means finding out how advanced it is, and then sometimes in the earlier stages, in helping cure it by getting it out of the patient. But with regards to my passion for lung cancer, I'd like to tell people that nobody deserves cancer. It doesn't matter what kind of cancer. It doesn't matter how much you smoked. Nobody deserves cancer. And we've alluded to the problem of how big of a problem lung cancer is. And we don't talk about lung cancer despite the fact that it is such a big problem. And in fact, if you look at lung cancer research funding, it's about 1/3 of breast cancer research funding, despite the fact that it is a much bigger problem in terms of scope of mortality. And so it is one of my personal missions to spread the awareness about the importance of lung cancer awareness, and also to have people to start thinking about, spreading that compassion, and rather than blaming patients who have lung cancer, use the same compassion and learn from all the progress we've made with how we treat breast cancer patients and how we've spread breast cancer awareness, and try to create that same level of improvement in lung cancer.
So we want to look at, because that's kind of a big part of what Mercy Moments seeks to do as part of the True Chat network of shows. We look for ways to provide listeners with actionable items. I think we've talked a little bit so far about some of the misinformation, right? That people who get lung cancer are just smokers, but even if they're smokers, as you highlighted, obviously nobody deserves to die of cancer, and it is a shame that it gets only 1/3 of the funding approximately of breast cancer, for example, despite the fact that it kills more people than breast, prostate, and colon cancer combined. So something about the funding equation doesn't seem to be adding up for us. But we're going to look at next screenings, treatment, and resources, a handful of different things that deal with who should get screenings, what treatment is like, what options exist, and then resources, because it's not just about the people who may have this or could get this, right? It's also about those of us, loved ones, family, friends, and everybody else being very aware of the real problem that is cancer. And part of what I thought that was interesting that you highlighted is some of the mystery still surrounding how people who don't smoke get lung cancer. And obviously, I'd assume that more money and research into that would be very valuable in helping prevent it in the first place. Some of the risk factors, but obviously, I think more information there would probably be useful.
Exactly.
So before we continue, Lance, all the shows on True Chat's network share a common goal, right? What is that goal?
Well, our mission here is to educate people by providing honest, open, and respectful conversations.
You think we're getting that done today?
We are. I'm learning quite a bit.
Excellent. So for those of you that want to gain access to some of these resources, look at all the places you can listen to Mercy Moments or share it with friends, the best and centralized source of information is mercymoments.org. mercymoments.org. You can go to the website on your computer or mobile device, and it's got all the ways to listen there. You can share it with friends, links to social media, and so forth. So be sure to check it out. It also has a link to Mercy Health's website, which is going to have an expansion of resources on a number of these different things that we're about to dive into here. So we're talking with Dr. Neravetla, and we're going to continue by looking at screenings next. So what options are out there for those people that are concerned about this issue?
The advent of lung cancer screening is a great new tool for us to be able to handle this situation. And it's a relatively new study that's been approved, but it allows us to try to catch lung cancer in patients who are asymptomatic. And why that's important is prior to this, most of the time when we were catching lung cancer was by accident, or when patients had disease that was so advanced that they became symptomatic. And once you start becoming symptomatic, it's usually a sign that your cancer is quite advanced. And the majority of lung cancer usually is caught in stage 3 and stage 4, which is the later stages of the disease. And so lung cancer screening allows us to try to catch patients with lung cancer at earlier stages while they're still asymptomatic.
There's a lot of different reasons to do a screening, but we've also talked about, and Lance brought this up beforehand. You want to expand a little bit, Lance?
Well, I was going to ask the doctor, what's the criteria that I have to meet in order to get screened? Because you were saying it's not just open to anyone. I can't just,
it's not like mammograms, right?
I can't walk in and get screened for lung cancer. There's a criteria. So can you share with the audience what that criteria, so if I know if I meet it or not?
People who are current smokers or who have quit within 15 years and who have had a 30-pack year history of smoking, which is a calculation that takes the amount of cigarettes that you smoke per day and multiplies it by the number of years that you've smoked. So you can be a 30-pack year smoker if you smoked 1 pack a day for 30 years, or you can be a 30-pack year smoker if you smoked 2 packs a day for 15 years, and so on and so forth. So it's that total pack year history. We also look at the age. So Medicare currently pays for screens for people who are aged 55 to 74. And then, of course, they don't pay for screens on people who are asymptomatic, because those patients should get a diagnostic CT, and also anyone who's had a CT for some other incidental reason within the last year.
And then you also said, or I read somewhere, where you have to be referred by someone.
Or a doctor has to order it
or something to that effect.
So
sorry, I'm not good with all this medical stuff.
That's fine. The lung cancer screen does need to be ordered by a physician or your healthcare provider, and have a conversation with them more about what lung cancer screening entails. And what the lung cancer screen is it's a special test that was designed specifically for this purpose. What we discovered in the past is that a chest X-ray, while not giving very much radiation, also didn't give us a lot of information. We missed a lot of lung cancers, and so we knew that a chest X-ray alone was not a good screening modality. A regular diagnostic CT, on the other hand, gave us lots of information, but also gave patients a high dose of radiation. What the lung cancer screening does is it's a specific low dose, low resolution CT scan. So it gives us less information than a regular CT scan, but a lot more information than a chest X-ray, with a little bit more radiation than a chest X-ray, but not nearly as much as a diagnostic CT does.
So that's kind of the reason why there are those differences between that and people that are familiar with a mammogram, right? With breast cancer. That's, you kind of just explained
Correct.
Why there's a difference between the two.
And why it has to be ordered, because you talked a little bit about, you don't want people everybody going to get this, because one, it would flood the system. And also there's a lot of people who probably have really low risk factors and have little to no chance of having this. And there's risks with the screening itself. And then if you have a false positive, situation, and then you're exposed to some kind of biopsy, right? I mean, all of those go into that equation, because I'm sure that there are people, I know Lance had that question before but there's other people probably thinking, well, why do I have to have it ordered by a physician?
Right. So there are nuances to lung cancer screening, and really to all screening programs. And I definitely recommend having a conversation with your physician about whether lung cancer screening is right for you. But I do highly recommend that if you do have that high smoking history, that you seriously consider getting screened and discuss it with your physician.
So say that Lance goes and gets a screening, right? What are the next steps after the screening? And if there is a finding, what are the options?
Sometimes your screen is just negative, which is good news. And then the recommendation is to continue screening annually. And the one thing to keep in mind is that participating in a screening program is not a substitution for tobacco cessation. So the number one most important thing you can do is still quit smoking if you currently smoke.
Like they say, you're always better off to quit from however long you've been doing it. There's a great improvement in your health as soon as you stop.
Absolutely. It's never too late to quit. In fact, there's data to show that even after a diagnosis of cancer, that people who quit smoking compared to those who don't quit smoking have a much better outcome. And so it's absolutely never too late to quit. But to your question about what happens if you do have a positive finding, that's where additional testing would typically be ordered. And it would depend on your doctor whether they would get something called a PET scan, which is a specialized test that shows if there's anything anywhere else in your body, or a biopsy. And there's several ways to do the biopsy. We alluded to earlier, we could go in through the airway and biopsy some things. Sometimes a radiologist can come in through your chest and do a lung biopsy. But ultimately, the goal is to try to find lung cancer early.
So what, say that there is a finding, what are the procedures nowadays? I mean, what are the most common ways that you approach trying to treat this cancer? Is it mainly surgery? Is it mainly something like chemotherapy? What's the main approach nowadays, and what's on the horizon? Maybe not here yet, but you're hoping will be available soon.
With all cancers, there is basically 3 modes of treatment that we look at. There's surgery, chemotherapy, and radiation. And for lung cancer specifically, with early stages, ideally patients would get surgery. Surgery has the best results with terms of a long-term cure rate for patients who are candidates for that. When you get into more advanced disease, those patients tend to do better with chemotherapy and radiation. But all 3 of those modalities continue to advance. And with regards to surgery specifically, we are seeing more and more robotic thoracic surgery. Our program in Springfield has been going on for over 10 years, and we have a very robust robotic thoracic surgery program.
What does that mean? Sorry, real quick.
That's okay.
What is robotic thoracic surgery?
So what that means is we are actually able to make small incisions and take the lung cancer out through these small incisions. And the biggest incision is where the mass comes out. So it's basically the size of whatever your mass is, which is maybe a couple inches typically. But the other incisions are less than an inch. And patients often go home the day after surgery.
Wow.
And so that, as you can imagine, is a much better, recovery, much better quality of life after surgery. And it also enables patients to do any kind of adjuvant therapy that might be recommended sooner and easier and better tolerated.
Sounds pretty good to Lance. I think you're all about that. Minimally invasive surgery, get me out of the hospital.
Well, when you talk about the recuperation, it's the less invasive you are, the quicker you can get back.
Right.
So you said though, most lung cancers are diagnosed at stages 3 and 4. Would that still be surgery stages, or is that too far advanced and you have to go into the chemo and the radiation?
Excellent point. And that's exactly what I was alluding to earlier. With stage 3 and stage 4, typically surgery is not in the conversation anymore. It can be sometimes used adjunctively for what we say palliative reasons. But at that point, you're primarily looking at chemotherapy and radiation. Now, there have been advances with chemotherapy, with immunotherapy and targeted therapy, and those advances are going to continue to, I think, be seen more and more. We've already seen some advertisements, I'm sure, on the TV with some of these newer agents. And then with radiation, we have something called CyberKnife, or also known as radiosurgery. And that has been used for patients who may not be surgical candidates for some of the earlier stages. Rather than radiating the whole area, we're able to do kind of a focused area of radiation and target the lesion a little bit more precisely with the early stages. So all 3 modalities, I think, are going to continue to advance with time. And as long as we can start catching lung cancer earlier, we improve our odds of actually making a dent in the disease.
I mean, you just said it. All three of those surgeries the most effective, but you have to catch it early. So, which is why the screening is so important, because the earlier you can catch it, the more likely you can have the surgery, which is the most effective way to cure it.
I'm sure there's some listeners, and we may have an individual on the program with us today who would be nervous when they hear about robotic surgery. But when you say that, to be clear, what's the physician's involvement in that process? In other words, is this we go in and press the button and the robot just goes and does it for you? Or this is robotic assisted surgery where the physician is actually the one in control of the entire process?
It's 100% physician involvement. And I do joke about that. There's no, robots gone wild anywhere. There's no surgeons operating from another county. I, as the surgeon, actually walk in the room, position the patient, place the ports in the patient myself, get everything set up. And then we walk like 3 feet away from the patient to the console, and we guide the instruments to do everything. So those instruments just have more flexibility and dexterity than our traditional minimally invasive chopstick type instruments do. So it allows us to use our skills more effectively, but the instruments are only doing what the surgeon is guiding them to do.
Okay. I just wanted to be sure to clarify that before we got out of here. Lance liked the sound, I'm sure, of the minimally invasive surgery, but what we said robotic, and I'm sure I'm sure he's not alone. And,
I knew what that meant, but thank you very much. I appreciate you clearing that up.
Yeah. So if people want to get more information, on risk factors, but whether or not they should talk to their doctor about getting a screening, obviously talking to their doctor is a good resource. Where else can they go?
Yeah, absolutely. One of the things I do like to emphasize is definitely use your physicians as a resource, even when you're trying to just quit smoking. That's an important conversation to have with your physician, and take advantage of all the resources that are out there. The quit line, your friends, whatever, Nicorette, everything, but definitely your physician is an important part of that battle. Obviously, you also need to talk to your physician about a lung cancer screen if you are a candidate for it. If you are a heavy smoker, I highly recommend that you have that conversation with your physician. But there's also some good resources at our cancer center in Springfield. It's an exceptional cancer center for a small town like Springfield. And we also have some counseling resources and plenty of helpful nurses that are very compassionate and work very well with all our patients.
Lance, we want to spread the word about Mercy Moments, right? Mm-hmm. So if you've taken time to listen to this program, we're very thankful. Be sure to share it with your family, though. These are quick, often 20-minute bits, and usually they're very practical, things that if you know them, you're more likely to be able to be on the lookout for them, right?
Great for that commute to work or home, and you can catch the information and share it with your family and friends, and hopefully make everybody healthier.
And not a big commitment. We're asking for 20 minutes once a month, and you can improve your life. So, and hopefully improve the lives of those around you. Lance, if people want to share this with friends or family, what are the different ways that people can tune in? Well,
you can use the Spotify app or Stitcher, Apple Podcast, or anywhere else fine podcasts are found.
For Mercy Moments on True Chat in Urbana, Ohio, I'm Justin T. Weller.
I'm Lance Jackson.
And I'm Dr. Soumya Neravetla.
Thank you so much to both of our guests for being on. For Mercy Moments, we'll see you next time. Be the change.